For about the first few days, we have these little mustache dressing. Essentially, it's a 4x4 gauze. You get a stack of them from the surgery center recovery room. Kind of roll it up into a little cigar. Put a big glob of Vaseline on it like this. And what you do is you just place this right under the nose. It pushes up the Vaseline right under there. And you don't have to use any Q-tips. You don't have to do any cleaning. I really don't want you messing with the nose for the first few days. These drip pads will get bloody. It's totally normal for this to be changed every 10, 15, 20 minutes for the first few hours. Then as the night progresses, every hour, every 2 hours for them to be changed. For the first few days, you should really wear this so you don't have to worry about drainage. You don't have to worry about dabbing the nose. After the first 3 or 4 days goes by, what you can do is you can leave it off if you want and just apply it with a Q-tip, put the ointment on. But you really need to have a good thick layer of antibiotic ointment or the Vaseline over here to make sure those nostrils do not dry out. This is the sling you go home with, gauzes you'll be given. This goes right under there. That's a dressing essentially, and the case is done.